Prothrombin time, PT, and activated partial thromboplastin time, PTT, are two common blood tests used to evaluate blood clotting function. The International Normalized Ratio, INR, is a standardized value that is derived from the PTT test. PT measures the time it takes for blood to clot after adding certain chemicals to a blood sample. The normal range for PT is typically between 11 and 13 seconds. If the PT is prolonged, it can indicate a problem with the blood's ability to clot, which may increase the risk of bleeding. The INR is a standardized value that compares the patient's PT to a reference range, which is typically between 0.8 and 1.2. The INR is commonly used to monitor patients who are taking anticoagulant medications such as warfarin, to ensure that their blood is not too thin and that they are not at increased risk of bleeding. PTT measures the time it takes for blood to clot after adding certain chemicals that activate the intrinsic clotting pathway. The normal range for PTT is typically between 25 and 35 seconds. PTT is used to evaluate the effectiveness of the intrinsic clotting pathway and is commonly used to monitor patients who are taking heparin, a medication that prevents blood clots from forming.